What is the primary function of the heart? Option 1, to pump blood throughout the body, Option 2, to digest food, Option 3, to filter waste products, Option 4, to produce hormones. The answer is, Option 1, to pump blood throughout the body. Which chamber of the heart pumps oxygenated blood to the body? Option 1, right atrium, Option 2, right ventricle, Option 3, left atrium, Option 4, left ventricle. The answer is, Option 4, left ventricle. What is the normal heart rate for an adult? Option 1, 30 to 50 beats per minute, Option 2, 60 to 100 beats per minute, Option 3, 110 to 150 beats per minute, Option 4, 120 to 180 beats per minute. The answer is, Option 2, 60 to 100 beats per minute. Which blood vessel carries oxygenated blood away from the heart? Option 1, veins, Option 2, capillaries, Option 3, arteries, Option 4, lymphatic vessels. The answer is, Option 3, arteries. What separates the left and right sides of the heart? Option 1, septum, Option 2, valve, Option 3, chordae tendineae, Option 4, pericardium. The answer is, Option 1, septum. What type of blood does the pulmonary vein carry? Option 1, oxygen-rich blood, Option 2, oxygen-poor blood, Option 3, nutrient-rich blood, Option 4, carbon dioxide-rich blood. The answer is, Option 1, oxygen-rich blood. What is the role of coronary arteries? Option 1, to supply oxygen to the brain, Option 2, to supply blood to the lungs, Option 3, to supply blood to the heart muscle, Option 4, to regulate blood pressure. The answer is, Option 3, to supply blood to the heart muscle. What is a common symptom of a heart attack? Option 1, shortness of breath, Option 2, sudden severe headache, Option 3, loss of vision, Option 4, severe abdominal pain. The answer is, Option 1, shortness of breath. What does ECG stand for? Option 1, electroencephalogram, Option 2, echocardiogram, Option 3, electrocardiogram, Option 4, endocardium graph. The answer is, Option 3, electrocardiogram. What is tachycardia? Option 1, a slow heart rate, Option 2, a fast heart rate, Option 3, irregular heartbeats, Option 4, heart muscle inflammation. The answer is, Option 2, a fast heart rate. What valve prevents backflow of blood into the left atrium? Option 1, tricuspid valve, Option 2, mitral valve, Option 3, pulmonary valve, Option 4, aortic valve. The answer is, Option 2, mitral valve. Which artery is the largest in the human body? Option 1, pulmonary artery, Option 2, aorta, Option 3, carotid artery, Option 4, femoral artery. The answer is, Option 2, aorta. What is the name of the heart's natural pacemaker? Option 1, AV node, Option 2, SA node, Option 3, bundle of His, Option 4, Purkinje fibers. The answer is, Option 2, SA node. What layer of the heart is responsible for contraction? Option 1, epicardium, Option 2, endocardium, Option 3, myocardium, Option 4, pericardium. The answer is, Option 3, myocardium. What is the function of the pericardium? Option 1, to pump blood, Option 2, to protect the heart, Option 3, to generate electrical impulses, Option 4, to transport blood. The answer is, Option 2, to protect the heart.
Don't miss out, hit the subscribe button now and turn on notifications to stay ahead.
Which artery supplies blood to the heart? Option 1, pulmonary artery, Option 2, coronary artery, Option 3, subclavian artery, Option 4, brachial artery. The answer is, Option 2, coronary artery. Which chamber of the heart receives deoxygenated blood? Option 1, left atrium, Option 2, right atrium, Option 3, left ventricle, Option 4, right ventricle. The answer is, Option 2, right atrium. What is the largest vein in the human body? Option 1, femoral vein, Option 2, pulmonary vein, Option 3, inferior vena cava, Option 4, jugular vein. The answer is, Option 3, inferior vena cava. What is bradycardia? Option 1, a slow heart rate, Option 2, a fast heart rate, Option 3, irregular heartbeats, Option 4, heart inflammation. The answer is, Option 1, a slow heart rate. What is the purpose of heart valves? Option 1, to contract the heart, Option 2, to pump blood, Option 3, to prevent backflow of blood, Option 4, to supply oxygen. The answer is, Option 3, to prevent backflow of blood. What is atherosclerosis? Option 1, hardening of the heart valves, Option 2, narrowing of arteries due to plaque buildup, Option 3, inflammation of the pericardium, Option 4, weakening of the heart muscle. The answer is, Option 2, narrowing of arteries due to plaque buildup, which is a major risk factor for coronary artery disease. Option 1, low blood pressure, Option 2, high cholesterol, Option 3, excessive sweating, Option 4, lung infections. The answer is, Option 2, high cholesterol. What is angina pectoris? Option 1, heart valve infection, Option 2, chest pain due to reduced blood flow to the heart, Option 3, sudden cardiac arrest, Option 4, irregular heartbeat. The answer is, Option 2, chest pain due to reduced blood flow to the heart. What is the primary cause of myocardial infarction? Option 1, heart valve dysfunction, Option 2, blocked coronary arteries, Option 3, high blood sugar, Option 4, infections. The answer is, Option 2, blocked coronary arteries. What condition is referred to as heart failure? Option 1, irregular heartbeat. Option 2, inability of the heart to pump blood efficiently. Option 3, complete stopping of the heart. Option 4, infection of the heart muscle. The answer is, option 2, inability of the heart to pump blood efficiently. What is the primary symptom of arrhythmia? Option 1, fever. Option 2, irregular heartbeat. Option 3, swelling in legs. Option 4, chest rash. The answer is, option 2, irregular heartbeat. What does hypertension refer to? Option 1, low blood pressure. Option 2, high blood pressure. Option 3, weak pulse rate. Option 4, heart inflammation. The answer is, option 2, high blood pressure. Which condition is commonly known as a silent killer? Option 1, arrhythmia. Option 2, hypertension. Option 3, heart failure. Option 4, atherosclerosis. The answer is, option 2, hypertension. What is endocarditis? Option 1, inflammation of the heart muscle. Option 2, inflammation of the inner lining of the heart. Option 3, blockage of arteries. Option 4, thinning of heart walls. The answer is, option 2, inflammation of the inner lining of the heart. What is a common complication of untreated atrial fibrillation? Option 1, stroke. Option 2, low blood sugar. Option 3, lung collapse. Option 4, kidney failure. The answer is, option 1, stroke. What does a stress test evaluate? Option 1, the strength of heart valves. Option 2, the heart's response to physical exertion. Option 3, the size of the heart chambers. Option 4, the thickness of arterial walls. The answer is, option 2, the heart's response to physical exertion.
Don't miss out, hit the subscribe button now and turn on notifications to stay ahead.
What is the primary purpose of an echocardiogram? Option 1, to measure blood pressure. Option 2, to visualize heart structures and function. Option 3, to detect lung infections. Option 4, to measure cholesterol levels. The answer is, option 2, to visualize heart structures and function. What does a Holter monitor record? Option 1, blood oxygen levels. Option 2, heart rhythms over 24 to 48 hours. Option 3, lung capacity. Option 4, pulse rate during exercise. The answer is, option 2, heart rhythms over 24 to 48 hours. What is the gold standard test for diagnosing coronary artery blockages? Option 1, ECG. Option 2, cardiac catheterization. Option 3, MRI. Option 4, CT scan. The answer is, option 2, cardiac catheterization. What does a high troponin level indicate? Option 1, infection in the heart. Option 2, heart muscle damage. Option 3, irregular heart rhythm. Option 4, low oxygen levels. The answer is, option 2, heart muscle damage. Which imaging technique uses radioactive material to assess blood flow in the heart? Option 1, CT scan. Option 2, MRI. Option 3, PET scan. Option 4, nuclear stress test. The answer is, option 4, nuclear stress test. What is the purpose of a coronary angiogram? Option 1, to evaluate lung function, option 2, to visualize coronary arteries, option 3, to measure blood sugar levels, option 4, to examine kidney function. The answer is, option 2, to visualize coronary arteries. Which test measures electrical activity of the heart? Option 1, MRI, option 2, ECG, option 3, echocardiogram, option 4, ultrasound. The answer is, option 2, ECG. What does a pacemaker do? Option 1, prevent blood clots, option 2, regulate abnormal heart rhythms, option 3, strengthen heart muscles, option 4, increase blood oxygen levels. The answer is, option 2, regulate abnormal heart rhythms. What is an abnormal QRS complex on an ECG indicative of? Option 1, kidney disease, option 2, heart conduction problems, option 3, lung infections, option 4, liver inflammation. The answer is, option 2, heart conduction problems. Which diet is recommended for heart health? Option 1, high-fat diet, option 2, Mediterranean diet, option 3, high-sugar diet, option 4, low-fiber diet. The answer is, option 2, Mediterranean diet. Which activity helps prevent heart disease? Option 1, smoking, option 2, regular exercise, option 3, high alcohol consumption, option 4, sedentary lifestyle. The answer is, option 2, regular exercise. What is the recommended level of LDL cholesterol? Option 1, below 100 mg divided by DL, option 2, 200 to 300 mg divided by DL, option 3, above 300 mg divided by DL, option 4, no recommended level. The answer is, option 1, below 100 mg divided by DL. Which vitamin is essential for reducing homocysteine levels? Option 1, vitamin A, option 2, vitamin B6 and B12, option 3, vitamin D, option 4, vitamin C. The answer is, option 2, vitamin B6 and B12. What is the first step in CPR for a person in cardiac arrest? Option 1, check the airway, option 2, call for emergency help, option 3, give chest compressions, option 4, administer oxygen. The answer is, option 2, call for emergency help. Which condition can aspirin help prevent? Option 1, heart attack, option 2, low blood sugar, option 3, lung infection, option 4, arthritis. The answer is, option 1, heart attack. What is the primary benefit of omega-3 fatty acids? Option 1, lowering heart disease risk, option 2, increasing muscle mass, option 3, boosting lung capacity, option 4, improving vision. The answer is, option 1, lowering heart disease risk. What is the most common cause of sudden cardiac death in athletes? Option 1, dehydration, option 2, hypertrophic cardiomyopathy, option 3, arrhythmia, Option 4, heat stroke. The answer is, option 2, hypertrophic cardiomyopathy. Which habit increases the risk of heart disease? Option 1, smoking, option 2, regular exercise, option 3, eating whole grains, option 4, meditation. The answer is, option 1, smoking. Which lifestyle modification helps lower blood pressure? Option 1, reducing salt intake, option 2, eating processed foods, option 3, sleeping less, option 4, smoking more. The answer is, option 1, reducing salt intake.
Don't miss out, hit the subscribe button now and turn on notifications to stay ahead.